And the other thing for the health system in our country is that there is, let's say, communication. Health education is very weak. So there was panic because we're not used to inform, educate the population in terms of health. And now we had just to diffuse messages, and this population was not ready to accept the messages, because they are not used to be informed and educated.
Welcome to another episode on Public Health Answers. In March 2020, COVID-19, which originated in Wuhan, was detected in Cameroon and has caused unforeseen circumstances like in any other country. Dr. Konji Konji highlights the need of promoting sustainable healthcare systems. Today, we want to know more about COVID-19 in Cameroon, and I'm therefore very excited to introduce you to Dr. Konji Konji, a senior public health nurse from Cameroon. He has served for 28 years in the Cameroon Public Service in the Ministry of Public Health. Since 2002, he has been working for UNICEF as an international consultant. Furthermore, he is a founder and executive director of the NGO Building Capacities for Better Health in Africa. He is also a founding member and president of the Cameroon Public Health Association, as well as member of the executive committee of the African Federation of Public Health Associations, and a lot more. So thank you very much, Dr. Konji Konji, for joining us today. I'll start with my first question. How has COVID-19 impacted Cameroon's healthcare system?
We have weak public health systems in Africa in general and in our countries. So, when COVID-19 came, when we had the first case of COVID-19, it was sort of panic in the system. A sort of panic because there was not preparedness, even though it started in China and in Europe, but there were not real preparedness in the health system. When I say health system is in fact not only at the central level, but at the regional and the district level. Well, when we started working on it or reflecting on it at central level, trying to implement WHO guidelines on how to manage COVID-19, but it was sort of panic in the system. And when you ask me how it impacted the health system, I will tell you that, let's say, the intervention that the Cameroon health system carried out for COVID-19 was, first of all, vertical. Vertical, it means that decisions were taken at central level, and then the other levels, lower level, had just to implement. And they even say vertical because the ministry and the government created new structures, to manage COVID-19. And this can be an advantage. It can also be something not good for the health system when you create new structures that are temporal. They're not permanent structures. So what I can say is that COVID-19, let's say, had a negative influence in the health system because we were not well prepared, and that since the system is weak, we just started working at central level and vertically. So, and this, let's say, after 1 year or 6 months or 1 year, the ministry decided to go downstairs, to go to the health district, but the health district were not prepared. So they had just to implement the orders, do this, don't do this, do this, do this, and sending message. And the other thing for the health system in our country is that there is, let's say, communication. Health education is very weak. So there was panic because we're not used to inform, educate the population in terms of health. And now we had just to diffuse messages, and this population was not ready to accept the messages, because they are not used to be informed and educated. So this is how I can summarize how COVID-19 came and how the health system reacted and what is the impact now, because now we have to manage to see how to make sure COVID-19 becomes a permanent health problem, not a vertical problem.
So you already said that like the systems panicked and public health communication is also difficult, like a difficult issue. And now how has the intersection between politics and health promotion changed in Cameroon since COVID-19?
Well, I'll tell you first of all that as far as health promotion is concerned, if you consider that you have, in terms of talking about public health, you have first health promotion, disease prevention, curative care, and surveillance and all of these. I'll tell you that in our country, the component that is the weakest is health promotion. The system is centered towards treatment, centered towards hospitals. And so now that we had such a problem that needs prevention, and there is confusion between promotion and prevention. So people are talking more about preventing COVID-19. And as far as politics are concerned, I'm very glad to know that at this time with COVID-19, many people, politics and many people had to understand what is health, because people used to think that health is what? Is hospitals, health professional. When you are sick, you go to hospitals. People don't see health promotion, disease prevention, you see. So now people have understood that health can be a threat, a global threat, and that health has a linkage with economy and the development. And I think for this time, we've seen the mobilization of politics, politics, we've seen the mobilization of the whole society against COVID-19. And this is good for public health. And I think we need to have this as an asset to make sure, as from now, we improve public health practice in our country.
So you already named a lot of like barriers which made it difficult. Do you also have like benefits or more barriers which have influenced like COVID-19 infections in Cameroon? So you said for one is for sure like communication was difficult. Is there anything else, or was there any like benefit which was good to reduce the number of infections?
The first benefit I can say is the fact that with COVID-19, you have these new materials that came, oxygen, for instance, in health facilities. We lacked oxygen in our health facilities, for instance, and many other medical products and material were lacking. But with COVID-19, with AIDS partners and all these, the health system has got material. I think this is a benefit. Secondly, it's about training of human resources. We are not used to train our human resource, let's say to do in-service training for our health professionals. But this time with COVID-19, well, from the central level downstairs to the district level, we have training that were organized to train people on COVID-19, how to prevent it, how to take charge of it or take precaution and all this. And I think this is another benefit. Another benefit is also the fact that now all the section of the country know, the stakeholders are very interested and know that health is a global matter. Health is a matter of everyone. It's not only a matter of a ministry. All the ministries in the government are mobilized to tackle this disease. And all the sectors are mobilized to tackle this disease. And I think this is a very big benefit. Now, if we can talk about difficulties or drawbacks, I will say the main problem is the fact that people think that this disease is invented. Let's say this disease is not a normal disease. You know, people think in the community that it's not a normal disease, and that this disease has been created or founded or fabricated somewhere and sent in around the world with an idea that Africans will be the most affected and will die. And people have this in mind, and also they are doubting on the disease. Or while people are doubting on the disease, they are suffering from the disease and they are dying. You know, so we need to work hard on communication. We need to work hard to educate all the section of the population, to go at the district level, to work with councils. And this is, I think, something that we have to do, to understand that the Ministry of Health is not alone able to solve this problem. And we need to do social mobilization. You need to do advocacy, and we need to conduct communication for behavior change, real communication for behavior change plan in a health system.
And what is your personal take-home message from Cameroon other countries should know about?
Well, my take-home message is to say that COVID is a disease, a real disease that people have to change their behaviors, to have new behaviors, because it's not an invented disease, it's a disease. But the other message that I'll have towards the government is to say, now that all the sections of the country, of the government are mobilized, let us take this as an advantage to make sure, as from now, we apply, let's say, health in all policy, health in all policy. For instance, I think we can take advantage of this COVID-19 mobilization of the society, mobilization of the whole government to implement health in all policies. I think this is a big message I can have towards the government.
So thank you, Dr. Conti, very much for your time and also highlighting all these key insights, especially also these lessons learned on that we need to social mobilize and that we need to implement health really in all policies, and that through COVID-19, actually this like in training for healthcare workers has improved. So thank you very much for giving your perspective to us today.
It's a pleasure.